top line. Okay. Perfect.
Hey, Miles. Wow, you look awful. What is wrong?
I do not know. I feel sick. My throat hurts. I think I have a fever. I have been feeling like this since last night.
Since last night? Have you called a doctor?
I thought about it, but I do not even know what to say when I call.
That is the problem, right? You know something is wrong. You can feel it, but you do not have the words to explain it. So you just do nothing.
Yeah, that is exactly it. Hey, it is Miles. And that moment is what today's episode is about. I feel terrible. My throat hurts, I am dizzy, I think I have a fever. But the thought of calling a clinic, sitting in a waiting room, talking to a doctor, answering questions I do not understand, then going to a pharmacy and picking up medicine I cannot pronounce, that feels harder than just being sick. But today, my friend Maya is going to walk me through the entire process, from the phone call to the pharmacy counter. She has done this before, many times, and by the end, you will know exactly what to say at every step. One key phrase before we start. I said it a moment ago, and I want you to notice it. I have been feeling sick since last night. That word, since, is the most important word in this episode. Doctors always ask when. Since gives them the answer.
And you will not have to do it alone. Okay, before we go anywhere, let me tell you the number one mistake people make at a doctor's office.
But I do feel sick.
I know, but I feel sick is too vague. A doctor needs 3 things from you: what is wrong, when it started, and how bad it is. I feel sick gives them 0 out of 3. And there is something else, something nobody talks about. Your body can react before you even speak. You sit in the exam room, the nurse wraps the cuff around your arm, and suddenly your heart is beating faster. That can happen because you are sick, nervous, or both. People sometimes call it the white coat effect. The medical setting itself makes your body go on alert.
So if my heart is racing at the clinic, it does not automatically mean something terrible is happening.
Exactly. Tell them if you feel it, but do not let it steal your first sentence. That is why we are going to prepare the sentence now, before you walk in. I have been feeling... If your heart is beating fast, your mouth still knows where to start. I know this because I made the same mistake. When I first moved to the US, I was 19. I got really sick one week. Fever, stomach pain, everything. So I went to a clinic, and the nurse asked me, "What brings you in today?" And I said, "I feel sick."
Remember that question. What brings you in today? That is the first thing they will ask you at every clinic. It is their way of saying, why are you here? What is wrong? What happened?
She asked me follow-up questions. Where does it hurt? When did it start? Have you thrown up? And I just kept saying, I feel sick. I feel sick. 3 times, the same words, because I did not have anything else. She was patient, but I could see it in her face. She needed more than that, and I could not give it to her. So, let me teach you the upgrades before we go. Quick fixes. Instead of I feel sick, try I feel nauseous. That means your stomach feels bad and you might throw up. Nauseous, much more specific.
So instead of I feel sick, I should say I feel nauseous and I have a sore throat. Like that?
Exactly like that. That gives the doctor 2 symptoms in 1 sentence. Much better. Now, a common mistake. Many people say, I have headache. But in English, you need the article, I have a headache, with the
I have a headache. Right. And if my nose is blocked?
Good question. The word is congestion. I have a lot of congestion. Not my nose is sick. Congestion. You will hear doctors use that word a lot during cold and flu season.
Wait, I just realized something. I always say I drink medicine. Every time. That is wrong, is it not?
It is. In Vietnamese, people say uống thuốc, and they translate it directly as I drink medicine. But in English, you do not drink medicine. You take medicine. I take medicine.
take, not drink. I have been saying it wrong for years.
You are not alone. Almost everyone makes that mistake. And here is one more. If someone asks you, "Did you vomit?" that is correct English. But in real life, people usually say throw up, not vomit. I threw up twice last night. That is what a regular person says at a clinic.
Throw up. I threw up, not I vomited. That sounds more natural.
It does. Vomit is not wrong, but throw up is what people actually say.
Okay, one more thing Maya taught me before we left. And honestly, this one explains something that confused me for a long time. You know what happened at my dentist last year? The assistant said, "Would you like to have a seat?" And I thought she was giving me a choice. So I said, "No, I am fine standing." She looked so confused.
That is exactly what I was about to explain. At the clinic, the nurses and doctors will give you instructions, but they will sound very polite. They will say things like, "Could you roll up your sleeve for me?"
That is the same thing. It sounds like a question, but they are actually telling you what to do.
Exactly. In American clinics, they soften commands to be polite. "Could you step on the scale?" That means step on the scale. "Please have a seat." Sit down. Do not hesitate. Just do it.
So when they say, "Could you," just do it. I wish I knew that at the dentist.
Now you do. You will hear it a lot today. All right, so here's what I want you to listen for today. Not a test, just the information that helps the clinic help you. Say what you feel and say when it started. I have been feeling something since a time. That since is not decoration. It tells the doctor whether this started an hour ago, last night, or 3 weeks ago. Then tell them what makes it worse. It gets worse when I swallow. A sore throat with pain when you swallow is different from a dry throat that only hurts in the morning. So that little detail matters. And if the doctor uses a word you do not understand, ask for simpler language right away. Could you explain that in simpler terms? Is not rude. It is clear. When they take your vitals, the language will be simple but fast. Step on the scale, roll up your sleeve, check your blood pressure, check your temperature. You do not need to explain much there. Just follow the instructions. And then save your energy for describing what actually feels wrong.
And one more thing. They will ask you, "Are you allergic to any medications?" That means, has any medicine ever given you a bad reaction, like a rash, swelling, or trouble breathing? If you know an allergy, say it clearly. If you truly do not know of any, you can say, "Not that I know of." Okay, symptoms, timing, and one question if I get lost. I can do this.
You can. Let us go.
So my first thought was, call my regular doctor, but Maya stopped me.
Your regular doctor may not be able to see you today. That is often how it works here. For same-day stuff like this, sore throat, fever, you go to an urgent care. It is a walk-in clinic, no appointment needed.
Walk-in?
Walk-in means you just show up. First come, first served. But call first. Make sure they take your insurance.
What do I even say on the phone?
It is one sentence. "Hi, I am not feeling well and I would like to come in today. Do you accept your insurance name?" That is it. They will say yes or no. If yes, they will tell you to bring your insurance card and a photo ID.
She made it sound easy, so I called. And it was easy. The whole call took 30 seconds. "Do you accept Blue Cross?" "Yes, we do. Come in anytime. Bring your insurance card and a photo ID." Done.
See, the phone call is always the easiest part. The waiting room is where it gets real.
We walked in. It was a small clinic. Clean. A few people already sitting in the waiting room. I walked up to the front desk.
They will ask if you've been here before. Say no, this is my first time. Then they will give you a form. Fill out. That means complete the form. Write in all the blanks.
And that is exactly what happened. The woman at the front desk asked, "Have you been seen at this clinic before?" I said no. She handed me a patient information form and asked for my photo ID and insurance card. The form asked for basic things: my name, date of birth, address, phone number. Then there was a section that said, "Reason for visit." I wrote sore throat, fever, dizziness since last night.
See that? You put the symptoms and the timeline. That is exactly right.
After I handed the form back, she told me my copay for today was $30. I paid with my card.
The copay. That is a fixed amount you pay each time you visit the doctor. It depends on your insurance plan. Some people pay $20, some pay $40. It is just the part you pay out of pocket.
Then I asked, how long will the wait be? She said about 20 minutes, 2 patients ahead of me.
That is normal for urgent care. They usually see people in the order they arrive, but urgent cases can go first. Grab a seat. It will go fast. And when they call your name, that is when it starts.
Miles Chen?
That is me.
Hi, Miles. I am Dr. Reeves. Follow me, please.
Maya stayed in the waiting room. From here, I was on my own.
All right, before we talk, I need to get your vitals. Could you step onto the scale for me and stand still?
Could you step onto the scale? An instruction, not a question. Just do it.
Perfect. 162. You can step down. Now, could you roll up your sleeve for me? I am going to check your blood pressure.
Sure. Roll up your sleeve. Another one. Maya warned me about this. Just push the sleeve up so they can wrap the cuff around your arm.
Good. 120/80. That is normal. Your pulse is a little fast, 104, but that can happen when you are nervous, sick, or both. We will keep it in mind. Now I am going to scan your forehead to check your temperature. 99.8. Slightly elevated. Not too high, but there is definitely something going on.
There it was. My heart was doing exactly what Maya said it might do. I could feel it beating fast before the doctor even asked me a question. And that is the moment when English can disappear, unless you already know your first sentence.
Okay, so, what brings you in today?
I have been feeling sick since last night. I have a sore throat, I feel dizzy, and I think I have a fever.
Since last night. Any other symptoms? Any nausea? Have you thrown up?
A little nauseous, but I have not thrown up. Did you hear that? I used nauseous and thrown up, 2 upgrades from Maya. And the doctor understood me immediately. And then something happened. She asked me to tell her more, and for 1 second, my heart got loud again. I almost said, I feel sick, and stopped there. But I caught myself. Actually, I have a sore throat. It started last night, around 8 o'clock, and it has been getting worse.
And does anything make it worse?
It gets worse when I swallow. And the dizziness, it gets worse when I stand up.
Okay, on a scale of 1 to 10, how bad is the sore throat right now? 1 being barely noticeable, 10 being the worst you have ever felt.
About a 6, maybe a 7 when I swallow.
And the dizziness?
Maybe a 4. It comes and goes.
All right, I am going to check for strep.
I had no idea what strep meant, and my first instinct was to just nod, pretend I understood, move on. But then I heard Maya's voice in my head.
Could you explain that in simpler terms?
Could you explain that in simpler terms? I am not sure what strep means.
Of course. Strep is a bacterial infection in the throat. Many sore throats are caused by viruses, and antibiotics do not help viruses, so the test matters. I am going to do a quick swab at the back of your throat, and the result should come back in about 15 minutes. It is nothing to worry about. I explain that about 10 times a day. You are definitely not the first person to look confused when I say strep.
That actually makes me feel better. She did not make me feel stupid. She explained it in simple words, and I understood. That phrase, could you explain that in simpler terms, works everywhere. With the doctor, with the pharmacist, even at a bank or a mechanic. If you do not understand something, ask. It is not weakness. It is the smartest thing you can do. And then I did something Maya taught me on the way over. She called it the teach back. After the doctor explains something, you repeat it in your own words. Not to show off, just to make sure you actually got it. Doctors use this technique with all patients. It is not a language thing. It is a communication thing. So, just to make sure I understand, a strep test checks if the infection is bacterial. And if it is bacterial, that is when an antibiotic helps. Is that right?
That is exactly right. You just explained it better than some of my colleagues.
That felt good. Not because I sounded smart, because I actually understood what was happening to my own body. And the phrase is simple. After any explanation, just say, "So, just to make sure I understand," and then repeat the main idea. If you got it wrong, the doctor will correct you gently. If you got it right, you leave the room with real understanding instead of just hoping you heard it correctly.
Okay, good news. The strep test came back positive, which means we know this is bacterial, not just a regular viral sore throat. That is why an antibiotic makes sense here. I am going to prescribe an antibiotic. The name is amoxicillin. Take it twice a day for 10 days. Take it with food. It can upset your stomach if you take it without eating. And here is the important part. Take it exactly as prescribed, even if you start feeling better after a few days. Do not share it, and do not save leftover pills for later. If you stop early, the infection can come back.
Twice a day for 10 days with food. Take it exactly as prescribed. Got it.
Any questions for me?
Do I need to come back if it gets worse?
If the fever gets high or does not improve, or if you have trouble breathing or trouble swallowing, come back right away or go to the ER. Otherwise, the antibiotic should start helping within 48 hours.
When should I start feeling better?
Most people notice improvement within 2 to 3 days, but keep taking the antibiotic for the full 10 days unless a clinician tells you to stop. Feeling better and being finished are not always the same thing.
Thank you, Dr. Reeves.
You are welcome. Feel better, Miles. I am sending the prescription to the pharmacy now. If you are not improving in a couple of days, follow up with your regular doctor or come back.
I walked back to the waiting room. Maya was sitting there reading something on her phone.
How did it go?
Strep. She prescribed an antibiotic. Twice a day, 10 days, with food.
Look at you. You said the diagnosis, the medicine, the dosage, and the instructions, all in one sentence. You were in there for 20 minutes and you came out speaking doctor.
My heart was still racing, though. She said strep, and I had no idea what it meant.
But you asked.
Yeah, I asked.
That is the whole point.
The clinic sent the prescription directly to the pharmacy. We walked across the parking lot, and before we went inside, Maya reminded me what usually happens at the counter.
Okay, at the counter, say your full name clearly. They will ask for your date of birth to confirm it is you. If they ask you to spell your last name, just spell it slowly, no rush.
What else?
The pickup phrase, practice it with me. I am here to pick up a prescription under the name Miles Chen.
I am here to pick up a prescription under the name Miles Chen.
One more thing. It is okay to ask about a generic. Is there a generic version that costs less? A generic has the same active ingredient and strength as the brand name medicine, so it is designed to do the same job in your body, but it usually costs less.
Generic. I will remember that.
Now, at many pharmacies you will hear, "Do you have any questions for the pharmacist?" Especially with a new medicine.
Okay, so I say no?
You can say no if you truly understand everything. But with a new medicine, it is normal to ask 1 or 2 questions before you leave, especially about dosage, mixing medicines, or side effects. The pharmacist is there to help you use the medicine safely.
So I do not need a perfect question. I just need to ask the thing I actually need to know.
Exactly. Are there any side effects I should watch for? That is all you need.
So I walked up to the counter, and I said exactly what Maya taught me. Hi, I'm here to pick up a prescription under the name Miles Chen. The woman behind the counter asked for my date of birth, March 12th, 1997. She typed something, looked at her screen, and confirmed. Amoxicillin, 500 milligrams, twice a day, 10-day supply.
See? Cleanest sentence you have said all day.
Then I asked, is there a generic version that costs less? And she said, this is already the generic. The brand name is more expensive. So, I was good. It is okay to ask anyway. Sometimes the generic saves you a lot. She also said, no refills on this one. A refill means you can get more medicine later from the same prescription. For an antibiotic, no refill is normal. Then she asked me, are you currently taking any other medications? I said no. She also asked about allergies, because that still matters even after the doctor sends the prescription. I said, not that I know of.
Those two questions, current medications and allergies. You will hear them often at clinics and pharmacies because they are checking for interactions and bad reactions before you take anything.
But then she said a phrase I did not understand. Good news, she said. Your insurance went through. No prior authorization needed. Prior what? The medicine was ready, but I still had no idea what that phrase meant. I walked back to Maya.
Prior authorization means your insurance company needs to approve a medicine before they pay for it. It is like they need to say yes first. Sometimes it takes a day or two. Today, you do not need it. That is good. The same thing happened to me my first year here. The pharmacy said prior authorization, and I thought I needed some kind of special government permission. I almost walked out and never came back. It is insurance paperwork. Usually, the doctor's office and the pharmacy help with the next step.
Prior authorization. Your insurance needs to approve it first. It is not a special permission from the government. It is an insurance step. So I went back to the counter and asked, is there anything I can take for the pain while I wait to feel better? She pointed me to the over-the-counter pain relievers, ibuprofen or acetaminophen, and told me to read the drug facts label carefully, especially the active ingredient, the directions, and the warnings.
Over the counter means you can buy it without a prescription, no doctor needed. But it does not mean no rules, you still follow the label.
So the antibiotic is the prescription. The pain reliever is over the counter. I can buy it right now, but I still need to follow the label and check what is inside it. Got it. She did not give me one universal dose. She said, check the label, do not take more than it says, and ask the pharmacist if you are not sure. If I choose acetaminophen, I need to be careful not to double up with another cold medicine that also has acetaminophen. If I choose ibuprofen, taking it with food can help reduce stomach irritation. So I need to follow the label, check the active ingredient, and ask if I am not sure. Got it. And then it happened. She looked at me and said, do you have any questions for the pharmacist? And I almost said no. It was automatic. The word was right there. But I stopped myself and remembered what Maya said outside. If I did not understand something about a new medicine, ask before I leave. So I said, actually, yes. Are there any side effects I should watch for? She told me, with amoxicillin, stomach upset or mild diarrhea can happen. With ibuprofen, stomach discomfort can happen, especially on an empty stomach. And with any medicine, if I notice swelling, a widespread rash, or difficulty breathing, that could be an allergic reaction. Get medical help right away. I said thank you. She said, feel better, Miles. Follow up with the clinic if your symptoms get worse. Follow up means check again later, or contact someone again later because the situation is not finished. That was a lot.
But you did it. You called the clinic, filled out the form, survived the vitals, described your symptoms, asked for clarification, went to the pharmacy, asked about the generic, learned the insurance phrase, and even asked about side effects. That is the whole visit, start to finish.
And I did not let my heartbeat run the whole visit.
It tried to, twice, but you stayed with the conversation.
Progress. That was a lot. But I actually understood most of it.
Yeah? What was the hardest part?
The first 30 seconds. When the doctor called my name and started doing the blood pressure and temperature, my heart was beating so fast I thought she could hear it through the cuff. She was wrapping things around my arm and scanning my forehead, and I was just standing there like, what is going on?
That is the white coat effect. The room, the cuff, the doctor, the waiting, your body gets alert. But you followed the instructions. Step on the scale, roll up your sleeve. And when she asked what was wrong, you had your first sentence ready.
I almost lost it though. When she said strep, I was about to just nod, pretend I understood, and move on.
But you did not. You asked. That is the whole point, Miles. Asking, could you explain that, is not a sign of weakness. It is a sign you actually want to understand. And doctors respect that. When I was 19 and sitting in that same kind of waiting room, I nodded through the entire appointment. The doctor said words I had never heard. I smiled. I said, okay. I left with a prescription I did not understand and medicine I took wrong for 3 days. 3 days. Wrong dosage, wrong timing, because I was too embarrassed to ask one question.
That must have been scary.
It was. And I promised myself I would never do that again. You did better than I did on my first visit, by a lot.
And here is something Maya said on the walk home that I keep thinking about.
You know what the real skill is? It is not knowing every medical word. It is being your own advocate. That means speaking up for yourself. Not aggressively, just clearly. I do not understand this. Can you write that down for me? Can I take a photo of the label? Those are not rude questions. Those are smart questions. You are the only person who takes your medicine home, so you need to be the one who understands it.
Be your own advocate. That phrase, advocate, it means someone who speaks up for you. And sometimes the best advocate you have is yourself. Let me do a quick recap of the language upgrades from today. I take medicine, not I drink medicine. I threw up, not I vomited. I have a headache, with the A. I feel nauseous instead of just I feel sick. Small things, but they make a real difference when someone is trying to help you.
And the medical basics underneath the language. Not every sore throat needs an antibiotic, which is why the strep test matters. A prescription medicine and an over-the-counter medicine are different, but both still come with directions, warnings, and possible side effects.
Real words, real labels, real questions. That is the part I did not understand before. Let us practice. I'm going to describe a situation, give you the phrase, and then your turn. Say it out loud. Muscle memory only works if you use the muscles. Situation 1. You call an urgent care clinic. You feel terrible. What do you say? I am not feeling well and I would like to come in today. Do you accept my insurance? Situation 2. The doctor says, could you roll up your sleeve for me? What do? You roll up your sleeve. It sounds like a question, but it is an instruction. They are going to check your blood pressure. Situation 3. Your heart is beating fast and the doctor asks what is wrong. You have a sore throat and you feel dizzy. I get a little nervous at doctor's offices, but I have been having a sore throat since yesterday. I also feel dizzy. It gets worse when I stand up. Situation 4. The doctor uses a word you do not understand. Could you explain that in simpler terms? Situation 5. The doctor tells you about your medicine. You want to know if you should eat first. Should I take this with food? Situation 6. You are at the pharmacy. You need to pick up your prescription. I am here to pick up a prescription under the name Miles Chen. Now, the core phrases. Slowly, you repeat after me. I have been feeling sick since last night. It gets worse when I swallow. On a scale of 1 to 10, it is about a 6. I get a little nervous at doctor's offices. Could you explain that in simpler terms? Should I take this with food? I am here to pick up a prescription under the name Miles Chen. Is there a generic version that costs less? That is today's episode. All the target phrases, the symptom description card, the pharmacy phrase card, and the medical phrasal verbs cheat sheet are in the free listener mini pack. Link in the description. And if this is your first episode, go back and listen to episode 10. That one covers how to handle personal questions from family. Some of the same boundary setting and softening grammar shows up there, and I built on it today. Next time you are feeling sick, do not just say, "I feel sick."
Tell them what feels wrong, when it started, and what you do not understand.
That is the whole episode. See you next time.
Don't miss out.
I can finally see.
Be sure to subscribe today.
See you next time!